What's up, champ? Hope you're having a great day. It's another day, another video, and in this video I had the privilege to present to you guys the latest member of Team B Fit Essential, Mohammed El Sayed, or as we like to call him, Dr. Mo. He's a kizomba teacher with 11 years of post-graduational surgical experience in hand, ankle, knee, and spine. So I highly suggest that you listen to this man, takes his tips. He's been posting multiple international posters, multiple international presentations, and multiple published articles on just surgery for, again, spines, feet, and ankles. Pay attention, take notes. If you have any questions about knee injury, ankle injury, hand injury, whatever the case may be, Dr. Mo had a huge part in my first knee surgery. He helped me a lot with that knee rehab. If you are dancing in heels, he gives you some highly valuable tips in the end of this video. So really pay attention, bring a piece of paper, take notes, and let's get it, champ. By dancers for dancers.
But yeah, bro, let's just I have some questions that I would love to run over with you before we go into all the things about the heels and joints and etc.
Of course.
But yeah, please tell me. So I did a quick poll in our Facebook group, and I got some questions back from it. And one of the questions, I think I'm gonna start with this one, was from a dancer, and she says, "What's the most normal joint issues that you've seen dancers get, and how to prevent it?" That's the follow-up question.
I don't specifically see a lot of dancers. I see some dancers, and I see more athletes, sports people, and football and stuff. If we're talking trauma injuries, a lot of ankle injuries, a lot of wrist injuries because they fall, they land on their wrists. It's not very common for a youngish person to break a hip or a large bone. It's mostly the ankles and the wrists. The long-term problems that happen over time, it's mostly knee problems. We saw a lot of knee problems with problems to the ligaments, problems to the soft tissue, problems to the cartilage. But yeah, it's very variable. It's very variable. But falling and twisting ankles is also very common. Especially in heels, and there's a lot of people who just twist their ankles, and they either come with a fracture or a torn ligament, or so yeah, it's
Got it. And when it comes to, I mean, you dance, how many years you dance now yourself?
I've been dancing kizomba for about 6 years. I started with a little bit of salsa because I was living in Newcastle and they only had salsa, so we went to some salsa classes and a little bit of bachata, and then I started dancing kizomba in a festival in the UK. And I danced kizomba since then. Like I have been dancing kizomba. I teach in the north of UK, so I do some, classes locally and some classes in Newcastle. But yeah, it's about 6 years now I've been dancing.
Got it. So when you come in and having your expertise in osteoarthritis and just joints in general, what is it that you see from your perspective that would be like a benefit for dancers? Because me, for example, coming in as a trainer and a coach, I just see like, wow, we need to train more. Like just physical education in general just is so valuable for dancers. But what do you see from your lens, so to say?
See, dancers have a much bigger impact on their joints and their bodies compared to people who don't dance or people who are not necessarily active. The issue is that it really depends on what you do. So what type of dancing you do. Is it more upper body type of dancing? Is it more lower body? Is it more like hip hop? Because each type has a different impact. For example, if you dance a lot of hip hop, it's very common to have knee problems and knee twisting or
this guy
soft problems like ligaments, meniscus, or to have arthritis later on in your life. twisting your ankle, so it really depends. But dancing does put you at a slightly higher risk because of the nature of what you're doing, because of, if you go out in the snow, there is a higher chance that you're going to fall and break your ankle. It's the same. Go dancing, there is a chance that you can injure yourself, and by dancing you're making your joints work more for longer hours, and the joints have a lifetime. Every joint has a lifetime. So the more you use your joints, the more you're risking yourself to get some damage. But then there are other things that we can do to also try and stop that from happening, or to reduce the chances, or minimize it, or push it as far away as it possible in life. So but yeah, dancers need to look after themselves, basically.
Yeah. So what would you say are the things we need to do as dancers, more than I'm not going to say the obvious choice, because a lot of people still don't practice that choice, but there is of course regular exercise, as in going to the gym, just home training, any type of resistant training. Is there any other things that you see as like, that's if more people did that, we will have a longer longevity of our joints?
Yeah, the things dancers need to do are pretty much the same things that everyone need to do to look after their joints, and that's basically make sure your weight is or you have a balanced weight, because there are some published there is some published research that suggests that every kilogram excess in weight reduces the lifetime of your joints by a few years. So you need to make sure your weight is appropriate. You need to make sure your diet is good. The better the diet you have, the stronger and healthier bones and joints you have. The nature of work that you do as well. You need to be careful. Make sure that you don't have fractures. Fractures increase the chance of having arthritis. If you break your knee, you will get arthritis a little bit sooner than if you haven't broken your knee. So injuries can cause this. There is also some talk about genetics factors, and that does exist. So some people genetically are more prone to joint problems. People who are born with bone deformities also are at a higher risk. And there is also a little bit of talk about females are at a slightly higher risk of having joint problems compared to men.
Really?
Yeah. So you just need to balance. There are things that you can control, like your diet, your weight, your exercise status.
Yeah.
There are things that you can't control, like your gender or your genetics. So yeah, you just need to be careful. And exercise, I really want to press on the exercise point, because it's not just that, if I run, I will have stronger joints. It has to be balanced exercise. You have to make sure that the joints get a lot of support from the muscles and the tissues around them. So you need to make sure, for example, for your knees, you need to make sure that you've got strong hamstrings, strong quadriceps, and strong calves. You have the muscles around the knee. You need to make sure that they're strong enough to support your knee. So
even more if you're carrying excess weight on your body, then it's even more important.
Yes, of course. And your knee and your hips are the weight carrying joints. Your spine carries some of your weight. Your knees carries a lot more of your weight, because carrying everything above. So you need to be careful. You need to watch out for your
hips. And when it comes to your obviously, like a well-balanced diet is obviously important, but is there any type of before I ask that question, before we talk, because I wanted to talk a little bit more about arthritis and osteoarthritis, could you just explain for us real quick, for the dancers who don't know, what is arthritis?
arthritis is arthritis. Itis means inflammation, and anything to do with arthro is joints.
Mm-hmm.
There are different types of joint problems. There is osteoarthritis, there is rheumatoid arthritis. Um, the one the one that I do more is osteoarthritis, because this
Okay.
is a predominantly bone problem, bone and cartilage problem. Whereas rheumatoid arthritis, there are other diseases that can affect your joints, and there are problems that are in the actual joints. It's not coming from elsewhere. So osteoarthritis is an inflammation of the joint and bone. Osteo means bone, so it's an inflammation of the joint and bone.
Okay.
Our joints are covered. If this is your knee, this is your thigh bone, this is your leg bone, there is a cartilage surface that sits in between. And this cartilage surface is to allow the friction, If you're rubbing bone on bone, the bone is going to get eaten. So you need that layer of protection that allows you to have this movement. This layer has a lifetime, because you just keep rubbing on it. If you hold two pieces of plastics and rub them, in 5 years' time, they're going to disappear or get smaller. The exact same thing. So your joints, the more you use your joints with bigger effort and more weight, you have more tension on this.
Okay.
Osteoarthritis is a problem of losing this cartilage, and then all the subsequent issues that come because of that, like pain, swelling, this is what osteoarthritis is.
Got it. So when I came out from my second knee surgery, the doctor told me I had arthritis. Until today, I'm not really sure if I have osteoarthritis. He just told me arthritis. And then I did a lot of research on like supplements to take to not prohibit getting it again, because I got something called PRP replacement. But could you tell us if there is any type of supplements we can go and take, or any type of vitamins or micronutrients in general that would like support this or speed up if I ever lose my cartilage, or somebody out there, how do I get it back? Is that even possible?
So cartilage is not, you can't really replace your cartilage once you have problems. There are some people who do cartilage replacement as an operation, but it's when you have a lot of damage, when you have a lot of osteoarthritis, the treatment change the joint,
Okay.
Or that's the more practiced treatment worldwide. The trying to replace the cartilage or surgically is more in younger people with smaller defects, where you can, like a small loss of cartilage, not a lot of loss of cartilage. In terms of diet, it's very important to make sure that you have good levels of vitamin D and calcium. If you have a healthy, balanced diet, you're fine. You need a healthy, balanced diet. You need milk. You need any source of vitamin D, any source of calcium, and that's for us, for orthopedic people, we really like people to have good levels of vitamin D and calcium.
Okay.
And then everything else, vegetables, fruits, whatever that can help your body and give you good health in general.
Got it. That's so interesting. I find it so interesting that the impact of nutrition and training has on just your overall well-being. What is when, if I have a knee problem, like I until today I still struggle with some knee problems, and I have a lot of my students, a lot of my online students, they tell me like, okay, I have pain in my back, or I have knee pain and I have it for years. At what time should you as a dancer go to a doctor, or at what type of pain are we looking for here?
Now when you feel pain, then your body is trying to tell you something.
That's a great saying. That's a great saying.
Your body is trying to say, if you work out and you get pain, then your body is telling you, okay, you've done enough. If you start getting pain in your knee, then your body is telling you that there is a problem. Now we tend to, it varies. It varies how much pain, where the pain is. But people can always, if it's, you can observe, you can see how long this pain has been for. If it's not going away, if it's not settling, if it's not something that you can explain in your mind,
Yeah.
then you should always ask for help or ask for advice. And
Got it.
especially with dancers, if you start getting knee problems that are not going away, you know, that getting worse or stopping you from doing your normal activities, then you need to ask for help. You know? So it's mostly pain, and then obviously anything else you see, like swelling, like you know, not being able to use your knee properly.
Yeah, like losing your full range of motion, for example.
Yes. Anything that's out of the ordinary, you know.
Okay, and what type? Who do I go to? So I have a knee, because I remember before I started my studies, they were, because there's so many. Okay, I can go to a osteopath, I can go to a physio, to a chiropractor, to a doctor. Who is my first guy? Like,
now this is really different from one place to the other, you know. Like here, for example, in our system, if you have a problem, you go to your GP or your general practitioner or the doctor who looks after you. And then he decides whether it's something that doesn't need anything or whether you need to see an orthopedic person or you just need physiotherapy. So they kind of direct you, you know. But it really depends. I think there is always, in every place, there should, or in most places, there will be some helplines or some. It really depends on the symptoms or how the pain is. So it's very difficult to. But generally, out of the ordinary pain that you're not used to, then ask for help. And it doesn't matter if you have a physiotherapy, a friend who's a physiotherapist who thinks that they can help with it, and you ask them and they say, okay, I'll have a look. They will know if it's something that they can't deal with and it has to be someone else. They will tell you that, okay, you need someone else, and vice versa. So if someone comes to me and I have a colleague who's a physiotherapist who I think can give them more help, like they need to build some muscles, they need to do this, then I refer them to a physiotherapist.
Yeah, and I love that. I love that. And what we talked about before is like, if I don't know something, I'm the first to say, I don't know that. Let me, but I do know some great people around me. I do know Mo. I do know Dr. Courtney. Like, let me go and talk to these people, because there are things I know that I don't know. So I think that's really
it's nice to know your own limitations in everything, you know.
Yeah.
If you don't know, you say you don't know. There's no shame.
Exactly.
You can always learn. You know?
Exactly. And like you said, you've been dancing kizomba for quite a few years now. I still think about it, like, and I've been dancing for 10 years now. I still, every time I see somebody dancing in heels, and especially if that's their full-time gig, I always like, how is that possible? Like, your feet and ankles and knees, they just got to be so teared up. And that's their full-time job.
Yeah.
What do you tell somebody like that?
There is a lot of heels is a very big topic. So I'm going to be talking maybe for the next 3-4 minutes.
Go for it. Shoot.
There's a lot of research about wearing heels, you know, and like I've come across some information that even tells you that 77% of the female population wear heels only on special occasions, you know, and about 30% wear them for work. 33% wear them for dancing, you know.
Yeah.
And amongst those 33%, there is also, you know, the height of the heel is important. So there is 1 inch, there's 2 inches, 3 inches, you know. So the lower your heels are, the smaller the effects are going to be. But there's always going to be effects, you know. So people really need to be careful with this, with wearing heels. And I know that it's something that, you know, people do because some people are comfortable in heels, you know? But if you think about it, you're technically changing the anatomy of your body.
Yeah.
So your feet are designed to be like this. When you're wearing heels, your feet go up, you know, the back of your feet go up. When you're standing and the back of your foot goes up, you can imagine how much pressure you're putting on the front of your foot.
Yeah.
putting even more load on the front of your foot. That's one problem. The other problem is that you're shortening the back of your leg. You're keeping it. If you're dancing, if you go to a festival and you dance 3 nights, 10 hours in heels,
which is normal,
which is normal, which is what people do, you know.
Yeah.
You are causing a significant amount of, you know, lifting your Achilles tendon up and your calves, and then you can end up shortening these muscles. You know, you can have problems putting your foot back up, you know.
Wow.
So it's important. Some people say you need to do a lot of stretching before and after you put heels on.
Yeah, so warm up and stretching after. I usually recommend, I would love to hear your take on this. I usually recommend for both men and women, but especially women, straight after social dancing, when you're back to your room and you shower, just shower your feet in cold water. Because, or even if you have ice, go for ice.
Muscle recovery, you know, you're putting your muscles under tension, and you're changing the anatomy of your foot. The effect starts from your foot and it goes all the way up to your spine.
Yeah.
You put 3-inch heels on and you're affecting from your spine all the way down to your foot in so many different ways, you know. So it's really important that if you really want to wear heels, make sure the height is okay, because the pressure that I was talking to, if this is the bottom of your foot, these are your toes. This part of your foot is called the ball of the foot. Okay. So when you're standing like this with the heels and you're putting pressure, if you're wearing a 1-inch heel, you're increasing this pressure by 22%.
By wearing a 1-inch heel.
1-inch heel. If you're wearing a 3-inch heel, you're putting 76% more pressure on the ball of the foot.
Wow.
76% on top of the normal pressure that you put on your foot when you're standing flat, you know?
Whoa.
So imagine over years and years and years.
Yeah. So let's say I'm listening to this. I'm a full-time dancer. I'm dancing in heels every day of the week almost, and I'm traveling to festivals, and then I do these 10-hour shifts in heels. What do I do? I mean, the situation, like, it's obviously not good for me, but how do I minimize the injury?
It's really difficult. Like, you can't ban people from wearing heels, but everything is about balance. You know, you have to be balanced. You have to make sure that if you choose to wear heels, make sure that it's not a very high heel. Again, something else that I recommend is the pointy heel shoes. The pointy shoes that are, you know, heels are a lot worse than if they're rounded, or if they give you a little bit of space on your foot, because you're kind of squeezing the top of your foot like this for a very long time. So the bones of your toes are bent. And that's why you end up in bunions, or, you know, in swelling or deformities, or so that's a really important point. And if you're having a pointy heel and it's 3-inch, imagine the 76% pressure is all going into that very tight triangle, you know.
That number is so scary.
That is a scary
number.
That is problematic. A lot of people have something called hammer toe. A hammer toe is when your toe goes like this, and it gets stuck like this because your heel is so high. There is too much pressure on the toes, and they're bent, and you keep them like this. The tissues that are around your toes can stiffen up. You can get stiffness. You can get, you know, pain. You can get a lot of issues that you don't really need, you know. So it's all about balance. So some of the advice that they say is avoid pointy heels, and if you go and buy shoes, go and buy shoes in the afternoon, because you give your feet a little bit of time to swell up a little bit, you know. And then you buy the shoe, you wear it, and it's comfortable. If you wear it earlier, or, you know, and then your foot swells up, it becomes a little bit tighter. So if you were buying shoes, buy them a little bit later on in the day. That's some general advice, you know. Avoid the pointed one. Try and change your your shoe wear from time to time. So if you want to dance, you can dance 3 hours in heels, for example, and 3 hours in flats. Try and have some balance. And obviously the stretches before and after putting your heels on. You know?
And combining that with a well-balanced diet and strength,
absolutely,
strength and conditioning training, and you're as good as you can be.
I'm going to just name out the like few parts of your body that get the effect, you know. So your foot is one to start with, and there's 3-4 different problems that can happen in the foot. There's something called Morton's neuroma, and that's you know the wearing the heels and all the tension and squeezing on your foot. You get there's small nerves that go between your toes. The tissues around these nerves start to become thick, put pressure on the nerve and cause some pain, you know. So there's shortening of your calves, of your Achilles, and then you're changing the balance of your knees, so you're getting more pressure, and the pressure happens more on the inside of the knee, which is the commonest place for people to start developing arthritis. You know, your weight goes through, you know, you get more weight going through the inside of the knee, the inner part of the knee. Your hips change, your spine changes. You know, your spine is designed in a way, it's an S-shaped way, to have this axial loading, to have the balance, you know, of you standing, of you jumping. When you wear heels, your lower back goes backwards a little bit.
Yeah.
For that to go backward, your upper back also has to balance, you know.
So you get a tilt, is that what you're saying? Like your hip goes forward?
Yes. So your hip
goes backwards,
backwards, and then your body, you get a little bit more of an arch. So your upper body also goes backward to try and balance. Otherwise, you're going to be leaning forward, you know. All this changes the dynamics of your spine, you know. So it's designed in a way, you're making it cope in a different way. So it's not good. You get lower back problems, you can get sciatica, you can get disc problems, you know. So it's really important. The hips also take a bit, the weight goes differently through the hips, and that's also a risk of arthritis in your hip, you know. So you kind of need to just be a little bit balanced about it.
Yeah, I think that's a great advice just in general, just finding that balance of like, okay, looking at your schedule, okay, where are you taking this? And especially if you're a new dancer, or like, especially if you're the younger generation of dancer. Like I watched my old hip hop battles here. I got so angry at my old self. I got so angry at my young self, just throwing myself around on my knees, like not giving a F about nothing, like zero warm up, no. And there was no knowledge like this, what we are trying to create, what we are creating for dancers out there. That this didn't exist at that time. I mean, you were your teacher told you to warm up, but like you didn't really care.
I know. And you know what's the best thing is? The best thing is that it's never too late to start.
Yeah.
You know? If you don't already have problems, it's not too late to start. The sooner, the quicker you start looking after yourself, your food, and your body, your weight, your exercise status, you know, balanced muscle, balanced strength, you know. The sooner you start, the more time you're giving your joints, you know, the more lifespan you're giving your joints. And it's important, obviously, to do things like, if you skate, put your, you know, support on, because if you break your elbow, you're going to get arthritis sooner. So, you know, like simple things, all things that make sense, you need to follow it.
Same thing if you are practicing your acrobatics and there is a chance of injury, like take the necessary precaution to, if you would injure, if something would happen, you just not take that extra effect of it also.
It's all about balance, you know. You just need to balance yourself, balance your life, balance your heel height, balance your, you know, exercises, your food, you know, and it's the best you can do. You can't stop your joints from aging. Your joints are aging, you know. You rarely see football players play beyond the age of 35, you know. 35 you're considered a strong man, but they've had a huge impact on their knees in the first 20 or 25 years of their lives that they can't do anymore after that for a long time. So it's, you have to have the balance, you know?
I had a conversation about this with, because there is so many different stats when it comes to, for example, football, like you're saying, or gymnastic, but like when it comes to, I think there should be like a prime age, so to say, when it comes to a ballet dancer.
Yeah,
But I
yeah.
feel that our generation of, or like this generation of Latin dancers and even hip hop dancers, I feel it's such a new phenomenon. So we don't really have like any data on it yet. So like Kork and Judith, like this generation, they are the first generation, and they are still so active inside of the community. So
Yes.
they are literally like the guinea pigs. It's like, okay, what is gonna happen with their bodies when they get
That's
older?
why I
Let's
keep
see.
saying to people, I don't know the long-term effects of dancing kizomba, you know. I don't know. Like I've only danced kizomba for 6 years, and I didn't know kizomba before that.
Yeah.
I don't know the impact it gives on your body, but if you dance kizomba, there is a lot of weight transferring and a lot of impact on your knees. There is a lot of, you know, impact on your spine.
Yeah.
I personally know a lot of kizomba people who ask me questions about their backs, and they keep saying that I keep getting back pain, you know. And it's, you know, for the ladies, for example, dancing in heels, you're doing a lot of weight transfer on a very high pair of heels, you know. And it's that's disastrous for your body if you think about it from a medical perspective, anatomical perspective, you know. But again, it's about balance, you know. You just need to, if your back starts hurting, your back is telling you that you're doing something wrong, you know. If your knees start hurting, and the same, I mean, I dance very little bachata, but I see people dancing bachata, and I see a lot of movements in the hip, or movements coming from hips, you know. And again, that's another risk that bachata might impose on you, you know. So you need to, and like you said, we're like the guinea pigs, so we need to protect ourselves, you know. We need to look after our bodies, and then go through what we don't know, you know, what we don't know how this is going to impact us. So we need to be protected, you know. We need to be ready. We need to have good muscles. We need to have good balance. We need to have to eat healthy, you know, especially people who do that professionally and dance for long hours, you know, and practice. And so I mean, I personally love dancing, but I want people to dance, but I want them to dance in the healthiest possible way, you know? And I think that will be good for everyone.
And you will be able to dance longer. I always say that my long-term goal in everything is to be able to dance the day before I die, and to be able to get there, even if it's a slow kizomba, you know, like even if it's just a two-step, you know, I still danced. So if I want to get there, like this is why I love doing these having these conversations with people like you, and just everybody I'm interviewing. It's such a blessing, and thank you for taking this time to really
Man,
sharing your knowledge with dancers.
Absolute pleasure, and I'm more than happy to help, you know. I think you know, it's nice to be able to share the little that I know, and you know, trying to promote people, and you know, try and help them look after themselves and look after their bodies. And I think there are things that maybe a lot of people don't know, but it's really important to know these things, you know. I mean, I didn't know about the effects of heels, on wearing heels whilst dancing. I had to sort of look it up and read about it and look at some research and all of this. And it's fascinating how much work that has been already done there, you know, like not just for dancers, like even for people who wear them for work. There are people who wear heels 5 days a week, you know. And there's a lot of very good information in there, so people just need to try and balance themselves, you know?
I think that's a great way of ending it. Is that you need to try to finding your own balance, because you're a very unique human being in yourself. Awesome. For everybody who's watching, we are super proud to announce that Dr. Mo, as we call him here, is part of Team Be Fit. So in very, very, very short period of time, we will have opening up the online clinic or the online gym for dancers. We will be able to keep in touch with him for anybody that's interested. And if anybody have any questions, how can they find you right now? Is it email or Facebook or?
I'm on Facebook. My account is mo_z. I'm on Instagram. It's mo_z_el Sayed, which is my surname. And yeah, I'm available. So I'm
Perfect.
very happy to take any questions.
Perfect. Is there anything you want to add in this? I think there's going to reach, or I know there's going to reach a lot of people, and a lot of people are going to benefit from it. Is there anything that we didn't talk about that you think like, man, this thing right here is valuable for dancers to know?
We are in. I mean, I think we're in a very difficult time right now. We're all living in a very difficult situation, completely out of the ordinary, you know, and that's also another reason for all of us to look after our health and our bodies and try and be healthy and be fit and especially for dancers, to all my fellow dancers and friends. I think you have a bigger impact on your bodies, and you need to look after yourselves. You know, you need to eat well, you need to exercise, you need to train, you need to, you know, ask for help if you want to know anything. So just keep fit and
now is the time more than ever.
Yes.
Last question before we round this up. If tomorrow, my favorite question, if tomorrow, when everybody woke up, you could put one sentence on their phone, and this the entire human being who has the entire human race would see that one message, that one sentence message, what would that be?
How long is the message?
You can cover my screen.
I really genuinely wish you all very good health, happiness, success. I really hope you all get what you want, and I really hope that you all have a nice, happy life. I think that's the only thing that I wish everyone. You know, I really
that's
hope
a great one. Oh, that's that one made me happy. That one made me genuinely happy, my brother. Awesome. Thank you so much for this one, everybody.
You're very welcome, bro. You're very welcome. Anytime.
It means a lot, bro. It means a lot, these conversations. I get a lot out from it, more than most, probably.
And you need to look after your knee as well.
Yeah, definitely. I'm getting an ice bath here later, so I will definitely do it. Hey, everybody who's watching, thank you so much for tuning in. Dance Specific Conversation. Remember, it's always by dancers for dancers, and we see you in the next video.